a brief hello and a brief introduction, and how was your surgery, or some little nugget of information for patients who had or might be having surgery coming up? Or
my name is Denise Ben, Wisconsin. My surgery lasted 33 minutes, and I had a 7-foot bypass. I feel great. I'm so happy I had this done. I was pretty impatient to have it done last week. I do have a question.
Yep,
At
good.
discharge, we had a discharge piece of paper stating that we could have Advil liquid gels,
Yes.
Delsum, and I was wondering if that's allowable even longer.
Great. So one of the questions is, what about pain medicine post-op? And some new stuff that we have on our list is Advil liquid gels and Delsum. And they're two different things, so I'll talk about them. Advil liquid gels are not good, but we give them to you because we can't think of anything better. So they have a risk of causing an ulcer, so we don't want you to take them, but in the post-operative period, if you take one or two, it's probably not the end of the world. Delsum contains dextromethorphan, which is N-methyl D-aspartate blocker, and so it helps decrease pain. And so we now use in our anesthetic treatment for you 2 combinations of drugs that affect the alpha-2 receptor in the brain and the NMDA, or the N-methyl D-aspartate receptors in the brain. So the new drugs that you're getting during the surgery and after the surgery include ketamine and clonidine and Presidex, which dextrometamidine. And those drugs are designed to make you feel better. And so in you, worked out okay.
I felt great.
Yeah.
I was off pain medicines pretty quickly, so
Yeah.
I didn't need to take the Advil, but I was just
Okay.
wondering.
All right. Does that answer your question?
Yes.
Delsum dextromethorphan is a narcotic-like drug. It's cough medicine, and the dextromethorphan may help decrease the pain.
Is it prescription?
No, you can buy it over the counter.
Cool.
Any other questions?
Is there an alternative to Pepto-Bismol?
Yeah. First of all, I want to get an amen from some of our older patients who took Carafate.
Amen.
Yeah. So they're. Did you take?
Never took Carafate.
You never took care. Okay.
It's poison.
It's awful tasting. It's a liquid metal, aluminum, and it's not that tasty. Pepto-Bismol is better, but if it bothers you, you can take the tablet. You can take the you can take the pill. You can take the chewable tablet, and you can skip it if you need to. It has some advantages because the bismuth helps kill the bad bacteria that can cause ulcers. So we like to use it for a while, but if it really bothers you, you can skip it.
What do you call them? Wild? What do you call them? Wild?
How long do you take it? Is that what you're asking? We have no idea what we're doing. So I make a lot of things up, but that's really the answer. Let me explain it. Remember, what is the biggest long-term risk of our surgery?
Ulcers.
Good, very good, class. All right, so we know that the biggest risk we're going to get after the surgery is an ulcer. Almost 3 to 5% of our patients get an upset stomach, burning, or an actual ulcer. But that means that 95 to 98% don't get it. Okay, now Pepto-Bismol, Tums, avoiding aspirin, eating a healthy diet, all those things protect against getting an ulcer. So the question then is, how long should you do it to everyone to protect the few people who might get an ulcer? And there it's just a judgment call. And so we don't know an absolute answer. We say 3, 6 months, something like that, and that will help protect you from an ulcer. But there's no absolute magic number because you may be lucky or unlucky. If you're unlucky, I might take it forever. If you're lucky, you might not need to take it at all. But God did not reveal to me during your surgery whether you were lucky or not. So we recommend you take it for a while.
I do have one more question.
Mm-hmm.
Sometimes when I am walking or bending over, I get like this half of a hiccup, but it really hurts. And I just want to make sure that's okay if I'm doing something wrong.
That's me. In other words, when you have a movement there, you rub the raw, stapled area of the stomach up against the diaphragm, and that gives that sticking pain. And that will gradually get better over time. All right, I'm taking 2 staples out.
Was it good?
Take these staples out.
No, they look wonderful. Your body's a little red there because it says time to come out.
Are you feeling that?
It feels good. It's like a little tickle. I've been wanting them out.
Applause.